Okay. Hello, my name's John Dyckman, and I'm sitting here with my longtime colleague and friend, Eric Greenleaf. We've known each other about 54 years and have had a lot of discussions about therapy and life over that time. And I'm very pleased that we're going to have an opportunity to sort of hear Eric's current thinking about his career as a therapist. And without further ado, I'm just going to go to the most basic and most important question, which is, Eric, what do you do as a therapist that helps people?
Well, you start off with a very pertinent and poignant question, since most discussions of therapy have to do with method. What I think I do is, when I can do it, is to help a person become more like themselves. That is, to use their own successful methods in life to leverage against difficulty or confusion or despair. And I have an axiom: the more person, the fewer symptoms. So, for example, during the pandemic, lots of kids and grown-ups showed up with symptoms of anxiety, depression, suicidality, confusion, aloofness, addiction. As soon as school was in again and the kids could go to school and we could be in each other's company physically, symptoms were replaced by the idiosyncrasies of personality, interpersonal emotion, and originality.
So in helping a person become more themselves, can you give some examples of how you do that?
Yeah. The general idea, and this is long removed from, but under the example and tone of Erickson and Erickson-influenced psychotherapy. I'll give an example, but the general notion is the simple one of finding out or even asking what someone does well unself-consciously, whether it's catching a ball or making a straight cut with a saw or kissing softly, whatever it is, need to be complicated, but has to be authoritative and without a lot of conscious thought to make it happen. So that's the notion. If I can find that out, I can then apply what the person is already expert at against an otherwise insoluble problem. That's one set of methods, I would say.
Well, that's a very interesting distinction about being unself-conscious. Could you say a little bit more about the difference between actions that are intentional and conscious versus the ones that occur more unself-consciously, was your word?
Sure. If you and I are throwing a baseball to each other, we'll be aware at least the first few throws of getting our glove in position, taking the right angle with our arms, if we haven't done it for a while or if we're awkward or beginners. You and I, having played baseball our whole lives pretty much, if you throw the ball over my head, I'll grab it out of the sky without looking. How do I do that? It's unself-conscious. I can do it over and over again. I can even do it if my older grandkid has got as strong an arm as you, throws it high on purpose to stretch grandpa. It's very hard to put into words how something is done well and successfully. Very easy to go on and on about what's difficult or failed.
Would you say that the intent is on the result rather than on the method?
Oh, yes, absolutely. Because Erickson, for example, might indicate that someone should do something different, or he'd give an assignment like go walk up the hill or go to the museum or the garden and come back and tell me what you saw.
Mm-hmm.
That's the method of directing inquiry and observation. And again, letting in more information than the person's routinized or symptomatic behaviors would allow.
So they're already doing something different.
Yeah, and Erickson's idea was the first thing you do with a patient is get them to do something.
Mm-hmm. Mm-hmm. Well, that's certainly true with when people are depressed and are inactive. Getting them to move is a real challenge sometimes. What do you do in those situations?
It's never the same each time.
Mm-hmm.
But I would try to get people's feet on the floor.
Mm-hmm.
And maybe have them practice sitting on the chair and putting their feet up, and then feet on the floor, feet up, feet on the floor. So as to encourage a difference rather than a description of the somnolent sameness that they're experiencing. You know, lying in bed all day or sleeps and down. Or maybe like another sort of axiom of mine is that if it works with kids, it'll work with grown-ups. And so I might, if I were seeing people in person and had a depressed person, I might have them play pat a cake, do something silly, childish.
Mm-hmm.
But anything not to be in a long discussion of the premises and rules and experiences of the problem.
Mm-hmm. Mm-hmm.
I want to compress the problem description and expand the possible modest differences in action. Right,
but it strikes me that this is different, even though you're both focusing on actions, different than the for instance, the cognitive behavioral therapist who might really push toward a new action. But you're doing something a little different, I think.
Yeah, and I would probably express it to the person I'm seeing differently, John. I would not give a kind of school marmish accounting. Here are the rules of action to follow in order to combat your negative thoughts. I want a record kept. There are people for whom this is exceptionally helpful, highly rationalized people, because they can be fooled in that same way of utilizing their extreme rationality, record keeping, neatness, to trigger something exceptional to that routine. To kind of lure them out of their bad thoughts by telling them to do what they're already doing, which is the the most direct hypnotic induction. You tell them to do what they're doing. If they agree, then they're following suggestion. If they oppose you, since you're telling them to do something useless, you'll get a better outcome for them. And what I mean by that idea that you're telling someone to do what they're doing is hypnosis. Laboratory and demonstration hypnosis, which I will demonstrate with you as a willing subject. You may not have noticed, but your eyes are blinking.
Mm-hmm.
And they will continue to blink. It's a natural thing. So you, being a contrary fellow, somehow controlled your blinking reflex as soon as I noticed you blinking and said it. And that's perfectly good. Now you're responding to the relational,
Mm-hmm.
and that's what modern therapists like, based on the research findings that the quality of the therapeutic relationship is the engine of therapy rather than a particular method.
Mm-hmm. Mm-hmm.
And that's confirmed apparently in many studies and different modalities and theories of therapy.
Yeah, they call it non-specific factors, which is a bizarre way of discussing it.
They should have talked to Martin Orton. They would have called it demand conditions.
Yes, yes. Say a little more about the role that hypnosis, either formal or informal, plays in the work you do.
Well, a kind of hypnotic approach changes the tempo and tone of my relatedness.
Yes, very clearly.
Because I'm a quick talker.
Yeah.
Quick written repartee. But I advise people, therapists, men in relationships with women, and anybody else, to listen slowly. So if I speak more slowly, and this comes naturally to me, then our interaction changes tempo. So the music, the emotions between us have a chance to be different or heard differently. We hear more of the notes.
Mm-hmm.
So hypnosis, an interpersonal relationship of softly focused mutual attention.
How would you say your work has changed or evolved since we first met, when you were doing quite a bit of more formal hypnosis?
Huh.
In your days at the VA?
Oh, well, yeah, I would do hypnosis more, whatever formal hypnosis was in vogue at the time, but as I read Erickson, he took the sort of elements of hypnotic relationship, the focused attention, the unknown outcomes, the I don't know. I became more easy with what's nowadays called naturalistic hypnosis.
Mm-hmm.
And one form of that is to tell a person to do what they're already doing in a slightly different way.
Mm-hmm.
So you asked an example, and my favorite, fairly recent example is of therapy, which is a little hard to explain, but shows what I think hypnosis is about. So I was teaching hypnosis in Bolivia at a university. We were doing a master's program that you taught in also, in Ericksonian and brief therapy. And after class, a woman came up to me with another woman. And these two women were part of a group of 6 who were very close friends, so much they had identical tattoos on their forearm.
Right. I remember them.
You do. And two come up to me. I'm in a hurry because I'm going out the door to meet with one of the professors. And one speaks via the other. And the whole therapy was this. She says about the other, about her friend, she's afraid to drink water or to bathe in water. I say, I don't have much time. What does she drink? The woman says, tea. And I say, does she drink milk? Because the tea was too lukewarm for my taste. What else does she drink milk? Oh, yes. Here's what I'd like you to do. I tell the woman who's silent. When you go home, take a bath in milk. Not a whole tub full. Just a gallon or a quart. I've said one thing or the other. Just go home, take a sponge bath in milk, come back tomorrow, tell me what happens. That's the entire therapy. Next day in class, they come back, and the woman who hadn't spoken says to me, walks up very frankly and says, I'm not afraid to drink water anymore, and when I get home today after class, I'm going to take a nice hot shower. That's the whole therapy.
And how do you understand that?
Well, that's why it's hard to prescribe a method that people can follow.
I don't mean that as a general understanding, but
what I think was, because again, there's no time to think. It's catching the ball or you miss it. That's it. So I needed some fluid contact with her that was positive, not negative. And so my understanding is sociological, or as Jeff Seid said about Erickson, anthropological. That is to say, I understand a person in their local culture and social environment. Not because I didn't know her as an individual, but she comes up, she's a psychologist, telling the professor that she has a psychological problem of an odd kind. And she's so embarrassed, she has a friend speak for her. So I take the problem in a way to be one of shame. And my response is to promote an experience of pride, the contrary emotion. Who is it who bathes in milk?
royalty.
Royalty, movie stars, beautiful women. So I tell her, I want you to bathe in milk, but not a whole tub full, too much milk. It's too expensive, is the implication.
Mm-hmm.
You can't replace abject shame by enormous pride. It wouldn't seem right. So I'm asking her in a way, can you tolerate a soupçon of pride, a little bit of pride? And she could.
Mm-hmm.
That's my understanding. That I see her as ashamed and want her to feel proud of her womanliness, her own skin, her own voice, her own body, because she's afraid to take things in or on her body that are positive.
Mm-hmm.
But about the specifics, including her name, I know nothing.
Mm-hmm. Mm-hmm.
So in that way, it's anthropological, John. I'm saying, I think I'm seeing in this young woman something about the sociology of student and teacher in South America.
Mm-hmm. Mm-hmm.
And that strong emotion becomes leverage for change. She's so ashamed she can't speak for herself in the class. Well, yeah, because she's telling the professor who's teaching how to deal with these aberrancies of human feeling, action, thought, relationship. Now she's going to hand me some, say, oh, look, this is true about me. And unlike an American who might march up and say, well, I got a problem here. Mm-mm. No, she shows up with her girlfriend. That's at least how I'm responding to the social cues,
Mm-hmm.
rather than thinking I have to find out about her intrapsychic life to
Mm-hmm.
make an intervention.
Well, that leads sort of naturally into the issues about how you see human emotion and feeling, because I know your view of emotions have changed some over the time. I'm wondering how you use your current view, if you could describe it, to help the people that you work with.
How I
Use your
my
view of
current view,
emotion.
I can imagine that most emotion is interpersonal. So I want the person to shift the relationship in which the emotion exists, and not to introspect about the emotion and try to process it as a way of shifting or resolving emotion. So I see emotion as between us. I'm in the Jungian sense extroverted, which to me means I feel my emotions here. You, the introvert, feel your emotions inside.
Mm-hmm.
And I'm sorry you're wrong about that, but even so, I can, even for you, I can point to, for example, I said something funny, you laughed. Should you be investigating your interior sense of humor? Or did I say something funny and you responded because we're in a relationship?
Yeah, but both for the introvert and for the extrovert, we've talked before about emotions as preparation for action,
Yes. Plans for action.
plans for action.
Yeah.
But what I'm hearing you say is those plans for action are specific to the particular relationship in which the emotion is expressed.
Yes. And if you look at psychoanalysis, for example, as an instance of a therapy that imagines the interior of a person's experience with them.
Mm-hmm.
Their examples are in, let's say their most extraordinary examples are of our childhood interpersonal experiences that remain as intrapsychic events in the person.
But the intrapsychic events could be something like a dream, which may or may not have a particular relationship to an outside person. It may be elements of the person themselves that are not at war, but in discussion, in relation.
Yeah, and I would just say to kind of devolve a difference into something useful, that if I were your therapist, I would only and entirely speak about the interior landscape.
Mm-hmm.
And if you were my therapist, you'd speak about the relational emotions all the time. Even though I have emotions and thoughts of my own, even though you have many and powerful relationships, but the kind of metaphor of understanding is very valuable. If you're going to do therapy, you have to understand things more or less with the metaphor of the person you're speaking with, as you're trying to do in this interview.
Yes. Yes.
Because otherwise you can't make the therapeutic relationship work.
Well, this leads to a fascinating, because we've talked about some of these cases and you don't need to go into the specifics, but I'd like you to say something about your work with people with extremely unusual, if not conventionally unbelievable experiences, and how this relates to your view of therapy.
Hello, puppy. Well, from the moment I was first an intern in the VA, I had the kind of understanding that you must take people in their own terms,
Mm-hmm.
rather than try to translate them into some therapeutic language of your devising.
Mm-hmm.
And so I've told you these stories where I met a guy who said he was the King of England. And it became clear to me that I would do better talking to His Majesty rather than contradicting him and saying, oh, no. You know, although I did that in the instance you know about. But I guess I would say that because I admire competence of the kind that I mentioned to you, that people doing things very well self-consciously, I'm interested in their experience within their own context. So I want to find out what the cabinet maker experiences of making a beautiful joint.
Mm-hmm.
If that's something I can use in the therapy,
Mm-hmm.
like in his disjointed relationship with his son. Because I want to take what he knows well and apply it to the thing he's helpless about. Do it like this. Do it just the way you X, Y, and Z. And I'll give an example later, which you know about utilizing swimming talent and experience to overcome nail biting. So I don't have the idea that the method has to fit the problem. I think that the method has to fit the person and be something they can do and be pleased to do in a new context, because they already know how to do it. I don't want to know about their feelings about their troubles. as a method of therapy, just as a means of empathy.
Mm-hmm. But isn't that empathy absolutely necessary to get people to listen to you
Oh,
when
yeah.
you ask them to do other things?
Yes. And this brings me to another part of my current therapy. Unlike the shibboleth that the therapist is not to speak of his or her own experience to the client. In fact, I have a patient who's a mental health worker who refuses to let me say a word about myself of any kind. But in order to express empathy, you've had an injury, I've had an injury, I spend a lot of time with you laboriously telling me all about your injury and what the doctors said and what your wife did and so on to establish empathy. And
Well, people need to feel understood. That seems crucial.
they do. And if they don't feel understood when I say, oh yeah, I had cancer 3 times or something.
Mm-hmm.
If they don't see it in my face, hear in my voice that I'm quite sympathetic to whatever they could possibly tell me. If that didn't happen, or if they found me offensive for doing that, say, well, I'm here to talk about myself, doc, you know. Then I'd say, well, tell me all about it. And I would demonstrate with them telling the story the same feelings that I demonstrate by telling them my story. No, I'm not adverse to hearing woeful and even horrible and haunting tales from people. And and I do hear them. Some of them are so awful. I have true stories of people's lives, especially as children, that I won't repeat them in a class or anywhere else.
Absolutely.
And the courage of little kids is, and their pluck, so touching.
Yep.
So there I go again. That's the thing that affects me in those stories. How they survived really brutal and horrible treatment. With so much novelty of expression in the world and so much persistent memory of the awfulness side by side. People develop lives, they marry happily, they have kids, they do wonderful work in the world, and they're haunted at the same time. So that separation in people, I'm interested in ameliorating in some way. Not by processing the trauma, but something else, depends on the person. Sometimes people write memoirs, so they make projects, you know, artwork, music.
Well, there's certainly different forms of expression of the story.
Yes, but it's not that they're equivalent at all. I mean, Goya's horrors of war might not be the same as, I mean, for Goya, that was it. But maybe Beethoven, wanted to have cannon fire go off or something, as his expression of an awful conflict and slaughter. So I'd want to find what the person, again, does well and easily, and then say, do that. I know an artist who has terrible physical pains and problems, and good doctors who are stumped, but it's definitely physiological. They just can't identify a cause and treatment. I talked to that artist about the fortunes of war, with the implication that they could start painting some. Again, because that's an expression of self, the same way that Stephen Hawking was brilliant when completely helpless to keep doing advanced mathematics, even though his own voice was replaced by a machine. Because he did it so well, he could still feel like himself most of the day, or so I imagine. So I lean a great deal on that, obviously, that, and I have examples from good child therapists who do that, who find something the kid does very well. I'll give you one example. A guy I know was a near PhD in math at Berkeley, so brilliant guy, scientific and mathematical. And he taught poor kids in the city mathematics. And I asked him, how did you do it? He says, well, I go into the class, I say, who knows the number? Hands shoot up. What are the numbers? 4? Excellent number. 7? Well, I like that number too. Okay. And who knows 2 by 4? And fewer hands go up. And he said to me, so every kid who answers knows something. And they're proud with what they know. And I have in mind therapeutically always the Muppet character, whose name I don't know, and the Muppets are each given a number or a letter, and this guy's number is 0. And he's a sort of homely Muppet, if you can imagine that, and kind of shaggy, purple, skinny, and he only has one line, and he says it in each time he appears. His line is, I am so proud. So if you see people as like kids is like people, the same thing. The idea that you're proud of what you can do and bewildered by what you can't strikes me as important. Psychotherapy is usually practiced as a shame-inducing activity. But you go and reveal your weaknesses, faults, defeats to a relative stranger, who then elevates you, like congratulating you for your CBT virtues, or your introspection, or your something, all related to your weakness, fault, difficulty, diagnosis, and so on.
Or you could just say to them, I think it probably took a lot of courage to make this call.
Yes, and that's what you and I would both feel is appropriate pride. To say, "Oh, I'm proud of you." Don't say it, but it carries. I say, "I'm proud of you," and in your expression, the other person will see sympathy, determination. You know what you're talking about. That it's hard to make that call to the therapist, and that the layers of emotional expression that you as a therapist have very effective on the patient.
To get back to the notion of sort of highly unusual experiences, let me try talking about it in a little bit different way. Could you say some more about belief and how that affects your approach? If someone has a very strong belief, you know, um, you know, women are inferior, the Bible tells me so, or whatever, some very strong belief that you may or may not agree with, and how you approach that, or the aliens, abducted me and did
the aliens abducted me. The black magic ruined our ceremony. I heard from your deceased wife from the other world. I reached inside, pulled out the poison. Now you'll be better. These little needles will activate your chakras in an appropriate way. This pressure on your back. My chiropractor today adjusted my face to help my breathing. He said, yeah, one side of the face. He said, most faces not equally,
they're not symmetrical,
but he said, yours, yeah. So did something happen? I say, oh yeah, I had a deviated septum. And so of course I have, like everybody, strong prejudices and beliefs. The guy who thinks women are inferior is not my kind of guy. And the beliefs are things I don't believe. I don't necessarily believe aliens visited the people I hypnotized and interviewed, but they experienced it. I want to distinguish experience from belief. They asked William James, do you believe in the doctrine of baptism by total immersion? He said, believe it, I've seen it. I'm a Jamesian. So and because my own therapy work with others starts out with dealing with people's dreams, doing dream groups back in the day, though I don't remember many of my dreams. But I know how to talk about them just fine. Talk about them like they're real. Do in the dream what you would do in that circumstance in reality.
Well, you talk about them like they're real because they are real experiences.
That's right. And so I want to realize appropriate conclusions to the dilemmas or activities of the dream. Just like I want the baseball team to take their last at bats, even if they're 5 runs behind. And I don't know the why of that, but it's an aesthetic. And baseball fans know that if they try to cut the game short because too many runs, what are you talking about? That's not even a pickleball rule. That's,
It's a little league rule.
Yeah, there are rule-governed social interactions that I trade on, and social language that I trade on, rather than translating what the person tells me into some convenient language for me and my buddies in therapy. In therapeutic practice, I want to keep the language, this is from Erickson too, of course, to keep the language the patient brings. Now that's difficult with Trumpists, but I suppose it'd be possible. I think I would determinedly point to the sense of oppression they feel. I lay off the true idea that they're projecting all over the place, and I would leave out the recent finding that leaders and followers have identical brain waves, and that they're really puppets of this psychopath. Never mind.
But what would you do?
I would express great empathy with their suffering and hope it broke through.
Mm-hmm. Have you had situations where that has not been sufficient?
Oh, yeah. Yeah. But
Is there
generally, I'm surprised on the upside. Had a recent experience like that where first session, one member of a couple walks out in the middle.
Mm-hmm.
But through a series of exchanges, where I wrote a brief note talking about trauma, though the person hadn't expressed trauma verbally, but can't live to a certain age without trauma as a likelihood.
That's a safe bet.
So I just talked about trauma. I can't remember the language. There's a few sentences. And the person comes back to therapy and says, thank you very much. And could I have a weekly session with my partner? So there it worked. And I think that will be my go-to, as it's been yours as a therapist, when the other person is belligerent or ornery or dangerous, even, just to say, boy, it hurts. Like Erickson said to his son when his son got injured and was bleeding, he said, boy, that hurts. And it's going to keep hurting for a while. To establish true empathy. And
credibility.
Both, same. Yes. So if you say to a guy who's belligerent, boy, that must hurt a lot, rather than you're out to hurt me, you don't have to try to work your way back through a projection, which is close to impossible. That is to work with the person's agreement. Well, don't you agree that you're really the one feeling this, and you're saying that it's me inducing it? Yeah, right. By that time, you're ducking. So I think it's a good bet that there's always pain. It's kind of, what's his name? The currently very popular guy. Forget his name. Anyway, a lot of very good therapists will emphasize how painful circumstances, relationships, physical experiences emotions have been for the other guy. So if somebody reports a horror of childhood, you can say, I imagine it's so lonely for you.
Mhm.
Yeah, it was scary too. Mom was going to come in and like that. So I think there too, John, there's a psychodramatic aspect to human interaction that Bessel van der Kolk and other people who talk about trauma emphasize as good therapy. But I think all therapy is psychodramatic because we're representing past and other and
Well, there's always a narrative.
yes, but the narrative is a drama representation.
Yes, a narrative is and a drama are very similar.
I don't show you my cancer. I tell you about it. You imagine it. And if I gave you a lurid description, I'd induce a lot of or invite a lot of strong negative emotions. But I don't have current cancer. We're friends, we're chatting.
Yeah.
I could tell you horrible things that make you throw up or get rid of me, like clients will do.
Sure.
Or I could tell you endearing things that embrace you and make you laugh or remember how much you love your family or stuff like that. So if you take hypnosis to be invitations to experience certain things, then you're real close to the practice of hypnosis in therapy.
Okay. So one last question. What advice would you give to young therapists?
Listen slowly. I hate to give don't advice, but don't categorize. And do imagine, do have a picture of what the person's talking about. Or if you're a sensate person, a strong bodily response that identifies what they're going through. That is, try to get inside their skin, not in a conceptual way, but in a heard, felt, and imagined way.
Mm-hmm.
And then it's not hard to be a therapist, even if you don't know what they should do, which is common, or you don't know what you should do, which is common. But you want to offer something. So beside listening slowly, I would advise keeping attention on the other person's face. Wittgenstein said that there are some things which must be accepted. And he mentioned number, time, space, and the human face. The human face, he said, must be accepted because it's the source of emotion. That was Wittgenstein, who gave away his money and slept on a cot. So just as a last comment about therapists, I like to know the origin stories of therapies before they become franchises. And they are wonderful and idiosyncratic and follow my notion of a good time with people. The therapists talk about exceptional, outlandish, that can't be so sort of things. And my kind of thing. So I look for those, and I also look for all the famous modern therapists, when they say things like Elliott Connie did in a recent lecture, this is very much like hypnosis, he said. And he was talking about solution-oriented brief psychotherapy. Or Sue Johnson was worried about doing therapy remotely with couples during the pandemic. And she said, and I was worried because I like to put my couples under the tent of trance before I work with them. I speak slowly and distinctly. And then she laid out a list of things people were doing teaching hypnosis. So it's not all hypnosis, but the focused attention on other people creates neurophysiologically a state that's akin to trance. We're on the same wavelength.
Whitaker used to say a sweet thing. He said that caring was the anesthesia that allowed the surgery of therapy to be possible.
And to quote another hero of therapy, Milton Erickson said, hypnosis is the stimulation of love in one person by the love in another.
Wonderful. That's a great place to stop. Thank you so much. This is a lovely discussion.
John, thank you as always.